Dr. Beatrice Bonyo, a gynecologist for the past 20 years. I've been practicing initially at the government hospital up to the year 2000, from 1992 to 2000, and 2000, when I opened this institution, Milimani Maternity Hospital, and I've been running this institution as the resident obstetrician gynecologist up to date. Day-to-day steps you can take. You need to encourage them, because some, when they just hear that they have gotten a cancer, they feel that that's the end of the story. But that's not the end, because they can get treatment. Some get, cure. Some get remission, and maybe may recur after some time, 5 years, 10 years, things like that. The radiotherapy, you find that they get relief and maybe get recurrence or die from other complications later. Initially, they have just that bleeding, which makes them weak. So maybe they may not do, their normal. Also, that bleeding is really inconvenience. You can't really even go on a safari, because you will start bleeding and you feel so limited, When the cancer spreads to later on stages, you find that there is pain. And pain, you have to be on painkillers. Bleeding is also still continuing. And so you are limited by the pain, the bleeding, and eventually now you are incapacitated completely because you can't work. What I would say is that our women need to go for frequent testing, or particularly pap smear is cheap and many can afford it, so they can go for frequent checkups, so that early detection of the cancer of the cervix will help them in their life. And also not to assume when they get bleeding problem, let them not assume that it is just a normal thing. There is nothing normal about this abnormal bleeding. So you have to be checked frequently. And I think if one is checked, you can be told you can take another checkup after maybe 2 years, 3 years, or something like that, so that you don't just wait until you are diagnosed with cancer. Then right now, we are also, people are getting vaccine, human papillomavirus vaccine against cancer, development of cancer of the cervix. Even as early as 12-year-old girls can get the vaccine. That will also help them. For the women are to go for pap smear. And from the first or the initial pap smear, you can be told when to come for the next pap smear. For example, if there is nothing in the pap smear test, then you can be told to go back after 3 years, 2 to 3 years, for another test. But if there are changes in the cervix, then maybe you will have to come some 3 months, even some 6 months, depending on the severity that has been noted. I thank the audience who have listened to this interview or presentation. And if you wish to see me as your gynecologist, you can book me through ponea.com and book for your appointments if you would like to be seen by a gynecologist. Thank you very much.